IVF is in vitro fertilization, where fertilization happens outside the body, inside the laboratory. On the day of egg retrieval, the clinicians under the ultrasound guidance aspirate the follicles and the follicular fluid is handed over to the IVF lab. We wash these oocytes in several changes of media, get rid of all the blood and other debris. Cleaned and washed oocytes are placed in fresh culture media which is kept inside the incubator, and this remains in the incubator for 2 to 4 hours depending upon the maturity of the oocytes. When the oocytes are being incubated in the incubator, the sperm sample is prepared and processed either from the ejaculate or from testicular biopsy sample. Now the processed sperm and the oocytes are placed in a special dish and kept on this microscope, which is called the ICSI microscope. After vitrification, the cryotopes are placed in color-coded goblets which are put inside aluminium canisters, and this is placed inside a liquid nitrogen tank. The temperature of liquid nitrogen is minus 196 degrees Celsius. At this temperature, all the activity inside the cell is at a standstill and the embryos are kept safe. This way, the embryos can be stored for more than 5 years and can be used at a later stage. This is actually cost effective for the patient because they do not have to go through an attempt of fresh cycle again.
Nowadays, many of the couples are very much apprehensive, especially when they go for treatments like IVF ICSI, whether the child that comes out of the treatment is thereon or not. But here in CRAFT, we never allow the use of a donor sperm, egg or embryo even if the couple wants for it. That's why many infertile couples come to CRAFT from different parts of India as well as abroad for their fertility treatments. When compared to normal pregnancy, the complication rates are high in elderly women, those conceiving after prolonged infertility treatment, and those following repeated pregnancy losses. The complications commonly seen are high blood pressure, diabetes, and sudden intrauterine deaths and intrauterine growth retardations. We also have a very successful and dedicated level 3 NICU to take care of these sick and premature babies.
In our level 3 NICU, we have all most modern facilities like high frequency ventilation, all modes of invasive ventilation, non-invasive ventilation, CPAP, Billy blanket, in-house ABG machine, ultrasonography, neurosonogram, echocardiography.
Since we never do donor IVF programs even on request, CRAFT can always ensure you 100% parentage for the babies born here.
CRAFT Hospital and Research Center, Kodungalur, Thrissur, Kerala. www.craftivf.com